Dr. Tapasya, you yourself work with so many teenagers, and what do you think? How do you take it when they experience, they want themselves to look better, or they want themselves to look perfect?
Yeah, so, because I'm an orthodontist, I do see maximum of my patient group is the teens, anywhere between the age of 10 and 15. And most teenagers who undergo orthodontic treatment stay with us, we see them regularly for about 2 years. So this is a great topic, or a great question, I would say, on self-image, because when they come in for treatment, whether they push their parents to do it or the parents bring them in, before we start treatment, we assess their smiles, we do some pre-treatment records, and we ask them to show their smile, or take some smiling photographs. A lot of times I see that they're very hesitant to smile. They're so conscious about smiling, and when I prod them, they would say, this is how I smile. I don't show my teeth, and because I don't like the way I smile. So if I fast forward this to adulthood, like Priya was connecting the dots, I also see a lot of adult patients, more so now with new technology where we can treat adults as well. And I see the same thing. Just yesterday I had a patient in the practice, and she's a beautiful girl, but she would refuse to show me her smile. And I would say, I'm your orthodontist, you need to show me your smile. And so I said, can you show me some photographs? She was browsing through her phone for 10 minutes and she did not have one picture to show me where her teeth were showing. So this, I feel, gets so deep-rooted. And, if you kind of speak to them, that this is how they've been through teenage years, and they've gotten so conscious about that girl was so overconfident, super confident otherwise, a brilliant girl, but they're so conscious about this one small thing that it just kind of gets deep-rooted. And even though all of these people grow up to be great individuals, but, somewhere that self-image issue does, stay close to the heart. And if not during teenage years, they do kind of now want to address this as adults, which is obviously can be done, but it's harder, it's harder on them to do it as adults. So which is why I feel that, probably targeting this issue when is the right time is the best time. Also, since, like I said, we see these kids for almost a span of 2 years, though I'm not a therapist, I'm not a psychologist, but we talk to them every visit. We spend a lot of time with these kids, and I do see a change in their self-confidence, the way they see themselves. They take selfies with me often. So at the end of the treatment, when I ask them for a post-treatment photograph, they give me a big beaming smile. So I think there's a big relevance, of the self-image to how the teens perceive themselves today.
And the self-image